You know, on several occasions we've been to the pediatric clinic at Coastal Family Health here in Biloxi, talking to Dr. Wendy Williams about different things that children deal with, you know, from like infancy on up to whatever age. How are you? It's good to see you
I'm doing
again.
great. It's good to see you too.
Today you want to talk about childhood asthma.
Yes.
Now,
Yes.
I would think that probably is a problem quite a bit down here on
It
the
is.
coast
It's
because of our environment.
Right. It's probably the chronic illness that we see most commonly in children.
Mm-hmm.
It's also the one that can be quite scary. Results in a lot of absences from school, ER visits, and so we are really trying to focus on eliminating what's triggering this so that we can keep these kids in school.
Yeah, a lot of it start out with allergies.
A lot of it can be triggered by allergies, and down here, like you said, the environment, there's pollen and dust and mold, and it's
One
kind
day
of
it's hot, one day it's cold.
Exactly,
you know,
that's a huge trigger. So that's one of the things that we're looking at. How we can't obviously change the weather, we can't change Mother Nature, but what can we do to help prevent those?
Now, at what age do you start seeing symptoms of childhood asthma?
Younger infants can wheeze, and a lot of times the parents will think that that's necessarily asthma. They get a virus and then it affects their lower airways, so they wheeze. But we really don't consider it asthma until they're older, 3 or 4, where it's chronic, it keeps occurring, they keep needing breathing treatments. And so that's when we really consider the diagnosis of asthma.
Now, what kind of, once you diagnose that in a child,
Right.
what is the usual treatment plan for
Right.
them?
Well, usually it's very much individualized. If it's just a one-time occurrence, then the main thing is helping parents recognize what the symptoms are, because it's not always, I can't breathe, I can't breathe. Sometimes it's a cough that just lingers and won't go away. So having parents recognize what is going on with their child, and to making sure they have the medicine at home to treat it. Know how to use it, whether it's a nebulizer or an inhaler, know how to use it so that they can keep it from escalating.
And a lot of parents probably make the mistake, yes you do, of going to the pharmacy and saying,
Right.
I'll get this. Our friend might recommend to them, oh, try this will work
Right.
just fine.
Right.
Every child is different.
Every child is different.
So
and-
you definitely need to get it diagnosed.
Right. And the medication for it isn't completely benign. It can have side effects, and parents need to know about that and know what to do if that occurs. Some children don't need to be taking this without a doctor, letting parents
definitely.
know about that.
Yeah, you've got to, because there, as you said, there could be some side effects that lead to more serious problems.
Correct. Once they've kind of progressed and it's not just an every now and then kind of problem, then usually we like to start them on a controller medicine. And having families understand this is sometimes somewhat difficult. It's kind of like if you have high blood pressure as an adult. You take your medicine every day.
I do.
Whether you're having problems or not, you just take it every day. And so asthma controller medicine's like that. And so understanding that every day they have to take it, whether they're wheezing, coughing, running around, doing a marathon, doesn't matter, they have to take their medicine. And the idea is to prevent them from having flares and having to use the albuterol.
Can it be cured?
No, it can be controlled. But it's something that,
Like
and
pretty
we
much
see that.
a lot of things like
Right,
that.
and-
COPD,
Exactly.
as you get older.
Right, and a lot of times it comes in cycles. You'll have it when you're young and exposed to all these new viruses at school, or kindergarten, first grade, and then it gets better for a while. And a lot of times we'll see another resurgence in middle school, junior high, when they're starting to play sports and all of a sudden are running more and are outside longer, then you'll kind of notice it coming back. And so that's another time that we start talking about the medication, controlling it, watching for triggers, and such as that.
Yeah, you definitely don't want to lock the kids away in the house or anything like that.
No, we want them to. My job is to make sure that they're controlled enough so that they can do whatever they want.
That's
Play
it.
sports, swim, do whatever they want.
And grow up.
And grow up and
Yes.
learn and stay in school.
There you go. That's
Yep.
a really important thing. So tell us some of the other things that here at Coastal Family Health.
Right. One of the things that kind of relates to the asthma is we recognize that a lot of times here in the office we can't always get to the full depth of what's triggering this, and so we have developed this program with a group called Community Health Workers. And what they are is they're just local members of the community that are trained in how to go out, how to make assessments, how to look for things. And we've done some workers with this with asthma, and we developed a program where you come and you get more education. We look for triggers. They go to the house. They look for roaches and dust and ceiling fans and kind of educate the families on how they can help prevent these things from happening.
Yeah, you'd be surprised how much dust will build up on your ceiling fan if you don't clean that thing
And then
on occasion.
the community health workers will come back to me and say, hey, we found this. You know, you might want to address it next time. And it's amazing the difference is just convincing a parent to quit smoking, or convincing them,
or at least
you
to
know,
go
using,
outside when you do it.
Right, use it. Quit smoking.
I agree. Well,
use, you know,
a lot of them trying to get them to quit, Doc, is just really,
I
really
know,
almost
that's my
impossible.
job. But using roach baits to get rid of cockroaches and those sort of things, like just that simple difference can all of a sudden, they don't need their medicine. They're well controlled and they're going to school and everybody's happy.
And you have to be careful too, because a lot of them think that, well, okay, I'll get a bunch of bug spray or roach spray and go through the house and spray. Worst thing that you can do, I mean, especially if you have small children in the house, because they can get into that. Then you end up having to call poison control, which is not something that you want to have to deal with.
Or air fresheners. They want to spray everything with Lysol so it's clean, but really they're triggering.
Oh, yeah.
So all of those
Yeah,
things.
those air fresheners only cover so much. They might cover some odors, but they're definitely not going to cover the dust mites and all those things that cause the asthma problems.
Correct. So we do our best. So that's kind of a new and innovative thing that we're trying here at Coastal. Some of the schools, we're going to start going into the schools. So if your child goes to Biloxi schools, and has asthma, you may hear about this and kind of wonder what's going on. And that's just what it is. We're trying to get in there. We actually can provide the dust covers for the mattresses and, you know, the training on how to use all these things. And so trying to really make a difference at that level.
Yeah, and cleaning, you know, washing your sheets and everything on a regular basis, because you got the dust mites in there, and you know your skin sloughs off so much of it, and then again that's just going to end up causing you some issues. So if they need to come here, I guess they need to just call for an appointment.
Yes, sir. That's right.
Okay, and you're located on Division Street in Biloxi.
Yes, we are.
And the construction's much better.
It's better this year.
Yeah, it's gotten a little bit better, so you can you know, get yourself on down through here. But what are the hours that the clinic is open?
We're open 8 to 5, Monday through Friday. We're open some Saturdays, usually 2 Saturdays a month we're open as well. So.
Okay, and of course y'all do all vaccinations.
Yeah, we do everything that you need.
From the time they're you handle a lot of prenatal.
Exactly.
You know, prenatal counseling. I know we've talked about that in the past. It's very, very important, prenatal counseling. So on up through you know however old. Doc, it's always a pleasure. Good to see you again.
Good to see you too.
If you need some more information about that, the number is on your screen. If you'd like to schedule an appointment to come in and have your child checked out, maybe you think they have asthma problems or some other issues, call the number on your screen, make an appointment. They're located on Division Street. It's Coastal Family Health.